on the air.
Hi, my name is Sue, and I decided to do a video blog today because I like video blogs myself, so this is my first. And what I would like to talk about is the big headliner that we've seen in all the internet news pages, and that's how gastric bypass patients supposedly live longer than fat people. To prove this, they used two studies. But unfortunately, the two studies they used really don't prove that point. The first study they used is the Swedish obesity study. This study eventually, the amount of people who applied for the study were 11,000, which were cut down to around 3,900 at the time the study was initiated in 1987. And of that group, only 2,000 completed the 2-year examination. 2,000 patients and 2,000 controls. We don't know what the breakdown is. We think most of the patients were some kind of gastric banding. We do know the breakdown, however, at the 10-year point, when they only had 627 patients who completed the 10-year point. That's 627 out of the original 3,900, so quite a few had dropped off there. And of course 627 controls. Of those 627 patients who completed the 10-year examination point, only 34 of them were gastric bypass patients. So whatever the study proved, I don't think it was anything about gastric bypass. Again, we don't know where the gastric bypass patients went. A big bunch of them dropped off. Of course, the bariatric surgeons are all assuming those who dropped off are out, too busy skating the streets, but they very well could have died. That study simply does not prove that gastric bypass patients live longer, especially as most of them were gastric banding, which gastric banding does not cause the vitamin deficiency that gastric bypass causes. In the second study, which took place in Utah, they matched 7,900 gastric bypass patients with 7,900 controls who were fat, and they had 108 more deaths within 7 years in the control patients, the fat patients, than they did in the gastric bypass patients. That's approximately 2% more deaths in the fat patients. One problem with that study is it didn't follow the gastric bypass patients very far out. 7 years is not what we call long-term, because most of the vitamin deficiencies that happen with gastric bypass patients, where they really start causing illness, happen after the 10th year. So had they drawn that study out to the 10th year and compared the gastric bypass patients to the fat patients, I think they might have gotten quite a different picture about the amount of deaths and the amount of illness. And another problem is the differential between deaths. 108 more deaths of the fat people isn't really too significant. And the other problem is that they did not take very important factors into consideration, such as exercise. Most gastric bypass patients exercise after surgery. A lot of fat patients who are told they should exercise to lose weight, and when it doesn't work to help them lose weight, they sometimes get discouraged with an exercise program. Had they averaged exercise in, again, your results might have been very different. In the Cooper Institute studies, they showed that people of all sizes who exercised had a much lesser chance of heart attack or death than people who did not exercise. So again, those two studies really don't prove anything about the longevity of gastric bypass patients, unfortunately, we may say.